So what is a plastic surgeon? What is a cosmetic surgeon? And is there a difference? So let's start with plastic surgery. So after you go to medical school, doctors do something called a residency, and we are working physicians. We have our MD. You end up getting your license during your residency, and you're doing specialty training in your chosen specialty. So at the end of medical school, you've probably seen all these cute videos where people find out where they match. You apply for programs in your desired specialty, and then you find out where you go, and that's where you do your residency. Residency programs are run by the ACGME, and they're very tightly structured and watched because they want to make sure that every single plastic surgeon, every single general surgeon, every single pediatrician gets a similar broad experience, and so that doctors, when they treat patients, have a similar broad, great fund of knowledge to take care of you. So cosmetic surgery is actually part of plastic surgery training. The only ACGME residency program that teaches residents cosmetic surgery is plastic surgery. Now, after you finish an ACGME residency, you will then be eligible for an American Board of Medical Specialties board, which plastic surgery is. And so you cannot take your boards unless you complete a plastic surgery training program. So that's typically how this whole thing works. And depending on how exactly you do your plastic surgery training, it can be anywhere from 6 to 8, 9 years to complete that whole process and then sit for your boards. Now, cosmetic surgery training programs and their board are very different. So they do not have an ACGME training program, because remember, the only ACGME training program that teaches cosmetic surgery is plastic surgery, and they do not have an American Board of Medical Specialties board. It's something they made up on their own. Why did they do this? Because they wanted to skip the line, or potentially couldn't get in the first place, because it's a very competitive training program and cosmetic surgery is lucrative. It's cash pay. Now, they have all these stupid infographics they like to show, and they try to pretend they have more training than us. They objectively don't. So their fellowships or training programs are anywhere from 6 to 18 months from what I've seen. They're not structured. They're also not learning from the best, right? Because the best go into plastic surgery, sorry. And they do not have the same structured requirements for their training that we do. One of the common things cosmetic surgeons say that's so stupid and shows how they don't know what they don't know is they'll say things like reconstruction is what we spend our time on and it's not important for cosmetic surgery, and it just shows they don't have any understanding of what they do. Reconstruction is the ultimate cosmetic surgery. When we are reconstructing an area of the body, understanding aesthetics and making that area look normal and as it should after trauma or cancer is absolutely cosmetic, and being good at those things makes you a better cosmetic surgeon, and it allows you to understand those procedures in a better way. So they're just wrong, and again, they're not recognized in many states. Like in California, you're not even allowed to advertise board certification unless it's an American Board of Medical Specialties board, because they don't want the public misled, and we call these, again, truth in advertising laws. Every state should have this, in my opinion. Unfortunately, they don't. Now, although they say on their website now for their board certification, that they require a surgical residency, that has not been the case. And there are many, many cosmetic surgeons out there that don't even have that. I did a video responding to one that lives in Florida, literally didn't even do a residency. She did 1 transitional year of training. So it is not standardized, it is not consistent, it is not regulated in the same way. You just don't know what you're gonna get. And you have to again ask yourself, why would someone do that method? Why would they go that route if they want to do cosmetic surgery? And I think we all know the answer. They didn't want to spend the time, they couldn't get in, and they don't care enough about your safety, in my opinion, to do the right thing. My goal has always been to do all of the proper training so I can be as safe as possible and be as good as possible at my craft. And that's not the way.